Hi, I'm Dr. Langley. I work at Pine Ridge Family Medicine. I'm a family doctor and a lactation consultant, and I happen to be a La Leche League leader too. So I was doing a series of kind of sessions like I would run La Leche League meetings, especially during the time of COVID because we weren't meeting in person. We recently got permission to start having La Leche League meetings in person again. But I thought that I would finish out the series anyway, just because I'd started it, and this is the last and final session that we would usually meet and talk about together. So I encourage you to definitely go out and find a breastfeeding support group, whether you're pregnant or have had your baby or have another baby on the way. It's a great place to learn from other moms. The best thing I got out of it from when I was able to meet in person and when I was a new mom was getting to hear all the different opinions on and different ways of doing things, because that's one of the hardest parts and the greatest parts about being a parent is that it changes all the time, especially with little babies. Just from week to week, the things that you're stressed about, the things that you're overwhelmed about change from one week being totally overwhelmed by one thing to the next is something completely different. So having so many different ideas of things to try and keeping you on your toes was a great thing that I continue to get out of La Leche League meetings. So the fourth session is usually about nutrition and or weaning. So a lot of discussion, especially in your local area, about how to eat healthily. Where do you get affordable, nutritious food? And La Leche League stance, and my stance as well, is that the best foods to eat are not all keto or not all Mediterranean. It's more of focusing on food that's as close to its natural state as possible. So tons of fruits and vegetables, unprocessed foods, so not the white bread as much as the whole wheat bread, not the white rice as much as the brown rice, and meats that haven't been processed through into lunch meat as much as roasted meats that you cook at home, things like that. And definitely nothing that comes in baggies or in the chip aisle in general. Those are not so good for you. I wouldn't call them bad, because I definitely still have times when I eat the bad foods. So it's more of foods that are more nutritious for you or foods that are less nutritious for you. Foods that tend to help you maintain your weight, or foods that help you to gain weight. So you kind of choose your foods based on what you need to do with your health and your body at the time, which is not always easy. I don't mean to make it sound like that. But just keeping that in mind, that it's not a moral choice. It's not that you're a good person or a bad person when you eat these foods. It has nothing to do with that. It's just about what foods you need at that time in life. So that's my and La Leche League stance on optimal nutrition. And when it comes to finding things locally here in Colorado Springs, I would usually go around and discuss what other people have found. I really like farmers markets these days after COVID, that there's a lot of virtual farmers markets where you just go and pick up the things that you ordered ahead of time, which is pretty cool. There's the classic Whole Food stores, which tend to be pretty expensive. Maybe Sprouts is slightly less expensive, but still some really good stuff there. But honestly, I come from the stance of it's better to eat lots and lots of fruits and vegetables than to only eat the fruits and vegetables that you can afford if they're organic. I don't eat all organic everything because I can't afford it. I've got 5 kids now. My baby is 6 months old, and we eat lots and lots of fruits and vegetables. And when we can, we check the list, the Environmental Working Group, EWG, the Dirty Dozen of which fruits and vegetables tend to be the most affected by pesticides. The most pesticides are on them when you bring them home from the store. So when I think of it, I get those organic, and the rest I get conventional. But honestly, I would much prefer my patients to eat lots and lots of fruits and vegetables that are conventional than to only eat what they can afford organic. As far as organic and pesticides go, I really like supporting organic methods of farming. I do think that they probably have more nutrients in them, and as a result of the plants having to survive without pesticides and without the chemical fertilizers, I think it's much better for the folks that are harvesting them, so I want to support them by buying organic when I can. But when it comes to my own personal nutrition, fruits and vegetables in general, it takes the priority for me. Another place that I try to save money in is growing my own. Sometimes it's ridiculous how much growing your own produce costs. So that's not necessarily any cheaper organic produce, but it's also a lot of fun, and it's a way to that I encourage my kids to eat more produce, is that when they can pick those sugar snap peas right off the vine, man, they disappear like that. Those tomatoes they've been slowly waiting for them to turn from green to red so that they could snatch them off the plant. They gobble those up. So making my life easier for trying to get them to eat fruits and vegetables is a win for me. I also like buying foods in bulk to try to save some money. So especially dried beans, dried grains, making my own bread I think is kind of fun. And that's an easy, a less expensive way to eat really nutritious food. Beans are so good for you. And also there's companies that offer those kinds of bulk produce. Azure Standard is one, Frontier is one. If you guys know of others, feel free to comment with other ideas for where to get not so expensive but really healthy food. But in general, it is a lot of cooking, and that can be super overwhelming when you're not used to that. I mean, me and my husband have been cooking our own food from scratch for many, many years, and there's still nights for sure when we do not feel like doing that. So some of my favorite tips are using the crock pot, so that you just have to find some time over the course of the day when you can find time to prep your dinner, and then just leave it to cook for the rest of the day. Don't worry about it, and that way it gets such in a rush around the 3 o'clock, 4 o'clock, 5 o'clock time when you don't have time or you don't feel like cooking, but maybe you could have found that time first thing in the morning while baby was sleeping, something like that. So using the crock pot, I love making chili in the crock pot. I'm also a big fan of every time you go to the grocery store, get a rotisserie chicken, just one of those pre-cooked chickens right there. It's good hot that day. It's good cold the next day on sandwiches or thrown on top of your eggs for a little added protein. Or I really love stir fries with it, especially if you don't feel like chopping all those vegetables, peeling them. Frozen vegetables are where it's at. They're so nutritious, and they've already been washed and cut and prepped for you. Just toss them with some of that chicken into a stir fry pan. Have a stir fry. You don't need to have rice. Rice is really hard for me to remember to get it started, so don't even bother with that. Having the vegetables and the meat for dinner, that is a super nutritious meal. Good for kids and parents alike, and so it doesn't have to be complicated. And add different vegetables, add different spices, add different sauces. That can really spruce things up if you've been doing that a lot recently, because it is a good go-to. When it comes to weaning your baby and starting to add more food to your baby's diet instead of just breastfeeding. So it's considered weaning whenever you add anything besides breast milk. So even just baby is 6 months old, so it's time to start adding a couple new foods. Baby's probably starting to grab food off of your plate. I know mine has. So you're looking for those signs, usually around 6 months. I like to wait till a solid 6 months before I introduce first foods. Some people like to add a little bit earlier, but don't do it because do it because your baby looks ready and is acting ready. There's always the old wives' tale that as soon as you start adding more foods, it'll slow down baby's digestion and they'll sleep through the night better. Study after study shows that doesn't reliably happen, that your baby might just have been ready to sleep a little bit longer at that time. And it didn't really have anything to do with added foods or adding cereal to the bottle or anything like that. So things that you're looking for around 6 months is baby's ability to sit up on their own. It's not that they don't fall over ever, but pretty reliably can sit up and hold their head up. And they'll start having tongue movements where they can move the food from the front of their mouth to the back of their mouth and swallow it. Early on, babies have a really strong gag reflex so that they won't move food back. They don't have the dexterity of their tongue to move food back to the back of their mouths to protect them if they put something small in their mouths so that they wouldn't choke on it. They start to lose that reflex around 6 months. I still have plenty of times when baby is coughing and retching on some delicious food, and that always stresses me out, but it's a normal thing. You'll notice baby starts to put everything in their mouths. They can grab the toys and put it in their mouths. That's how they're learning about the world, and it's also showing that they might be ready to start some first foods. And they also will start having a desire. They'll be watching you very carefully as you're eating that delicious food, and they look a little heartbroken that you're not offering them that delicious food. And they'll start reaching for it and trying to get it for themselves. So that's always a good sign to look for, that they're ready to start. Usually you want to start with a single ingredient food at a meal, just one at a time, to just kind of ease them into this. And they really don't need any added sugar, any added salt. They just need the pure food in and of itself. Some folks really like to get the jars off of the store, and they'll talk about which stage of foods those are. Other people like to just take whatever they're eating for dinner and grind it, mash it up with a fork a little bit, maybe microwave it a little bit longer to make it a little softer, cool it off completely, and then start feeding little bits to baby, or let baby start taking little bits themselves, making a big mess. But that's kind of a fact of life with learning to eat these new foods. The things you need to be careful of is no honey until they turn a year old, and no really hard round foods that they might choke on. So if you want to feed them grapes, make sure the grapes are cut up and not whole round grapes. Nuts, again, maybe turn them into like a fine powder before you let them have a flavor of that. Raw carrots, make sure they're big. If you want to do like a baby-led weaning and maybe let baby chew on a cold carrot for teething purposes, make sure it's a big carrot, not a little carrot that could possibly get pushed entirely in their mouth and choke on. Let's see, round candies are a bad idea, very chokeable, and they don't need that sugar anyway. So start with those single ingredient foods. It takes, 14 times before a baby might possibly like that food. So just because baby doesn't seem to like a food, don't give up. They're just babies. They're getting those first flavors in their mouths. It's a big experience for them. So just keep trying and coming back to them. Don't label them as picky eaters yet. They're just figuring things out, and that's okay. Let's see. So you start adding those foods. It's also good to think about what nutrients your breast milk is starting to lack around 6 months. So iron. The iron that's available in your breast milk is very absorbable by baby, but about 6 months their need for iron starts to get a little bit higher than what even your breast milk can provide. So starting some high iron first foods is always a good idea. So sometimes I'll do really finely ground beef, or I'll chop up some chicken or turkey real fine. So kind of pureed meats are a great choice. They also make cereals that have iron added to them. Those are okay. Another thing that you can do to make sure that your baby is getting that iron and actually absorbing it into their stomach, into their system, is to try to offer it with something with vitamin C in it. This is getting pretty technical, but iron and calcium try to fight each other for getting absorbed into baby's body. So spacing those out a little bit, which can be tricky with breastfeeding. Spacing calcium like yogurt or cheeses away from the iron-rich meats or iron-fortified cereals that you're giving them can help them to absorb it. And with those iron-rich foods, try to have things that are rich in vitamin C. So carrots, apples, citrus are some classic things that vitamin C or acid helps to absorb the iron better. But that's getting pretty deep into the weeds. Often I'm just feeding whatever I happen to be eating to baby and mashing it up for him. So don't stress about that too much. And when it comes to weaning and decreasing the amount of breastfeeding, that is a really personal question, and you can ask lots of moms for how they did it and when they decided it was time, and that's a tough one. So at meetings, when we're talking about this, I'll talk about kind of the pros and cons both ways, kind of like this chart in the back. So we might make a chart like this and think about the most loving thing that works for everyone. I mean, it doesn't have to be all or nothing. In fact, avoiding abrupt cutting off of breastfeeding is better for baby as well as for mom. It puts mom at big risk of mastitis to suddenly just quit breastfeeding. It's best to decrease gradually 1 or 2 feedings every week or so if you're needing to cut it off. If you have a medical need, a medication or a surgery coming up that they're saying that you need to stop breastfeeding now, then you need to talk with a lactation consultant about, is that real? Is that something that really needs to happen? Make sure you're getting expert advice from a breastfeeding expert that that's true, because some doctors and surgeons are miseducated about that sort of thing. So this could be your chance to make sure that they're doing the right thing. And then if it does need to happen, get their help. And that way you have someone, if you do develop mastitis, you've got someone that can provide you the antibiotics that you need to feel better, because mastitis is not fun and can lead to bad things down the line. So again, this is the kind of chart that we might have after discussion. So on the one hand, you want to continue breastfeeding as a mom because it's easy parenting. There's good nutrition. You even can decrease your risk of breast cancer by continuing to nurse. But on the other hand, you're feeling exhausted, you're feeling touched out, you need to maybe go back to work, you need to have some space, some personal space would be nice, or maybe you want to have another baby, and so continuing to breastfeed is putting off your periods, and so that you're not able to get pregnant. So I mean, those are both really valid things on the pro and con side of continuing to nurse. And baby has an opinion, has a role in this too. It's a relationship. It's a dyad. So baby might, you could try to imagine how your baby, your toddler feels about all this. That it tastes good, it feels good, you get some time with mom. But on the other hand, sometimes it's the babies who are quitting breastfeeding because they're so busy, or because there's so many other delicious foods that I just don't have room in my stomach to breastfeed anymore. So it's a good thing to have another mom around, another parent around, that you can talk about this and really weigh out the pros and cons and what your heart says about all this. Don't quit on a bad day. Don't quit because people are telling you that a baby older than 6 months shouldn't be breastfeeding anymore. The American Academy of Pediatrics recommends breastfeeding till at least a year, and the World Health Organization recommends breastfeeding way beyond that, just as long as it works for mom and baby. So there are definite benefits to mom and baby to continuing to nurse if that's what works for them for years and years. So far, the oldest baby I've breastfed has been 3, and me personally, I breastfed until I was 4 years old. And it looks a lot different to be breastfeeding a toddler than breastfeeding a new baby. They're not breastfeeding all the time. And you can even make negotiations with them. You can say, not right now. When we get home, we can breastfeed. It doesn't have to be in public. A lot of moms are breastfeeding their toddlers just at home around nap time and bedtime. And that's a really important and beautiful part of their relationship, and it works well for them. But I promise that baby will not be going to college still breastfeeding. We don't have to get into the weird things that people say, but that just doesn't happen. The baby will wean at some point, and it will be okay, and it will be a little bit sad to be an end to that part of your relationship, but it'll be all right. So hopefully this was a little bit of a start, but most of all, anyone who's watching this and needing help with weaning, help with decisions about weaning, find some other similar like-minded moms to talk about this with, to make sure that you're doing the right thing for you and not because you're being pressured to. Hopefully you enjoyed this video. My other videos about breastfeeding are there, and please be sure to subscribe to my channel. There we go, so that you can find out when we release new videos. Thanks for watching.